Hello and welcome. In this programme we will be focusing on South Africa, specifically around a couple of health and welfare initiatives Scania are currently involved in throughout this region. In order to give you a feel of what's really going on, we will be hearing from those directly involved on the ground and also speaking to some studio guests who can shed further light on the projects. Our first guest is on the phone now, Gail Roberts, the Area Human Resources and Risk Manager at Scania South Africa. Hello Gail, could you tell us something about these local initiatives you have been helping to implement and exactly what your goals are?
The Wellness Initiative works in the sense that we have a committee, and what we work on is topics that are of relevance to the organization. So there's a number of people that have got sugar diabetes. We will have a month where we'll focus on diabetes as a topic. And we also have a nurse that comes to site that the people may go to for various tests. So they can test for HIV, sugar diabetes, their blood pressure. And by doing these types of interventions, we've just found that it's helped almost preempt people going to doctors and asking for assistance and accessing their medical aid sooner rather than later.
And with regard peer educators, what exactly has made that scheme so successful?
We found that historically people would rather speak to their colleagues than to their managers or HR department with regard to their personal problems and experiences that they're having.
Thank you, Gail, and thank you for joining us.
Thank you very much for this opportunity.
To combat the further spread of HIV, as many channels for information as possible are needed. In South Africa, Scania provides health programs for employees, for truck and bus drivers, as well as for the community at large. Word of mouth among peers generally has a stronger impact than official information. At Scania South Africa, this is an organized part of healthcare and information. It is carried out by so-called peer educators. Simo Gama is a production system coordinator and responsible for health and safety issues at Scania's assembly plant in South Africa.
So we started to share this serious information. Gents, it's a Friday today. Is everyone armed? What do you mean we're armed? No, gents, you know, sometimes you go for a drink and you get one or two more, and then do you have maybe some protection for yourself, because you never know where you're going to end up. So what I've seen that as a peer educator is that we don't impose to people what they need to do. We don't take decisions for them, but we get them to be informed. And once a person is informed, they make informed decisions.
They also encourage colleagues to attend health screenings at the monthly wellness days arranged at work. At a typical wellness day, nurses are present at Scania to offer health screenings to assess glucose level and blood pressure, as well as to offer HIV/AIDS tests. Cooperating with Reality Wellness ensures that a strict code of confidentiality is upheld. Employees can be tested and receive subsequent treatment without jeopardizing their jobs due to a diagnosis.
For me, as a peer educator, for 36 months running, I'm enjoying it. I'm loving it, and for what the Swedish organization have done in terms of wellness programs, it has helped us a lot.
We now welcome our second guest, John Viner, from the Swedish Workplace HIV and AIDS programme. Could you tell us how you think the partnership with Scania is progressing?
Well, we've been working with Scania since 2006 through the programme, the Swedish Workplace HIV/AIDS programme. But actually our partnership goes way before that, with back to the 1960s actually, through one of the organisations that runs the programme called the International Council of Swedish Industry, or in Swedish Näringslivets Internationella Råd, NIR. And back in 2003, Scania, together with some other companies, was asked by NIR to look at what were challenges for operating down in southern Africa. And one of the main things that came out was HIV. So this program was launched together with another organisation called IF Metall. That's a union that also organises workers at Scania, but also has relationships with unions down in sub-Saharan Africa.
So can you tell us some of the positive results that have come from the initiative?
Well, if you think that in sub-Saharan Africa, you've got 70% of the world's population living with HIV. So globally, 35 million people are living with HIV. You've got 70% of that amount in sub-Saharan Africa. Okay, 50% of those don't actually know whether they've got HIV or not. If a worker has HIV, they know then how to manage that disease. If they don't have it, they need to know how to keep themselves protected so they don't get infected. So given that importance of testing, I can tell you that Scania in South Africa has 95% of all its workers who've tested, and they know their status. So what Scania has been running since basically the partnership started is a comprehensive program that looks at the education and the awareness for workers, and then extending that out to the families and to the communities, and then also encouraging people in different ways to go and test. And for those people who are living with HIV at Scania, and there's quite a few in Scania South Africa, they are then connected to a program to ensure that they get every sort of bit of help that they need. And this ensures at the end of the day that they can continue to work, be productive, and that's obviously in Scania's interest.
Thank you, John. That's it for this programme. We'll see you next time.